Every year, 530,000 American citizens file for bankruptcy due to medical expenses. When you're looking for health insurance and Medicare plans, it's easy to get lost in a sea of information. Trying to tackle the search on your own can be incredibly confusing. As we talked about in recent episodes of the podcast, we at Compass Financial have built a team of professionals that we work with to serve our clients. Today, we have Lisa Eppolito of Positive Insurance Solutions, and is a Medicare specialist and a health insurance specialist for under 65. Lisa, welcome to Compass Wealth Conversations.
Thank you. Thanks for having me.
So how did you actually get into the business of Medicare and health insurance?
So back in 2008, I used to do construction management, and I had met somebody, a recruiter, who was recruiting for an insurance carrier. So I just started working for the insurance carrier, selling mostly high deductible plans for everyone under 65. I was in it for about a year or two, and then I decided to kind of go out on my own, represent all the different carriers, and start selling Medicare too.
So how many actually insurance carriers do you represent in the Medicare space?
Oh, geez. In the Medicare space, I'd say probably 10.
You know, because we talk about it to our clients all the time, because especially when we're dealing with retirees, we have people that are hitting 65, getting ready to retire, or they're close to, and they're like, well, we have questions about an Advantage plan or a prescription plan. And we're like, listen, we know what we do well, but here is our expert in that space, and that's you. And we know that you've dealt with my parents, with my in-laws. We have a great relationship, and every conversation we've had with people it's been awesome. So where does one start when they're looking for Medicare?
So the conversation about Medicare can start pretty early. You know, some people choose to get their ducks in a row about a year before they turn 65, or before they're going to need coverage by coming off of a group plan. Other people wait until the month of their birthday and, they give a call then saying, what do I do? So, we mostly deal with the carriers for supplemental plans, for prescription drug plans, for Advantage plans, if somebody chooses to go that way. But I will still walk them through signing up for original Medicare and all the steps and the timing. So, the best time to start would be about 3 months before you're looking to make that change. So that's when we can actually start signing up for, Medicare.
So if someone is getting ready to retire 3 months out, but what if they have a spouse that's still working? They have to sign up. They automatically get A.
Actually, now you have to sign up for A when you turn 65. If you're not collecting Social Security already, you have to sign up for it. So, I show people how to go through Medicare.gov and go through that. And, sometimes I'll walk them through it so that they're signing up for the correct A, just A, or A and B. Mm-hmm. So if somebody is going to be on a group plan still, we discuss how large is that group, because they may or may not need Part B, even on a group plan.
Okay. So when they're looking for either an Advantage or a supplement plan, what is your recommendation there? Is it like a one fit all, or can be specific to every person?
It's specific to each person.
Okay.
I talk to people about their medical needs, their budget. That's obviously a huge factor. Of course, there are some plans that have more coverage than other plans. I'm very blunt with the people that I speak with, and they know what they're getting when they purchase the plan. They know if they are getting a certain plan where all they have to do is pay the premiums, and then almost everything is covered with very little out of pocket. Or they know if they're going to get a plan where they don't pay any premiums and they have to pay a little bit more out of pocket. Mm-hmm. But, it's definitely not a one size fits all. And when I have the conversations with people, we can figure out what's going to fit them best.
And that's usually what it is. It's usually a conversation to see what needs they have. Because sometimes people, when they're looking for this information, they're like, oh, well, I can just go with this plan and this will cover everything. And it's not always that case, right?
Definitely not. And people need to be aware there are certain plans that they can only choose during their, initial enrollment period. Mm-hmm. So without going through medical underwriting, there are certain plans that if they wait till they are on Medicare for, a few months, they're going to have to go through medical underwriting if they want to change to a certain plan. That is always the main takeaway that I want people to have when I go through their Medicare options with them. I want them to know, hey, if you're choosing this plan, you might not be able to choose the other plan later on down the road. So if you want that plan, now's the time to go with it, so.
Right. And so why would you get a plan now? Right. Like just say, I'm turning 65.
Yes.
I want to sign up because open enrollment's coming. It's almost October and I know it's crazy season for everyone over there. But even during open enrollment, so people call you now to say, hey, listen, I'm on plan 6 or whatever it is, and I need to change because of these reasons. And it might be beneficial to them to go through the underwriting if there's no health concerns, correct?
Absolutely. Yes. So, and that's again what we take a look at when we're looking at somebody's, whole picture. So also because it's open enrollment does not mean that they can change every plan. Some of them, they might have to get through medical underwriting, which is why it's important to get this right the first time around.
Right. And then by just researching it online, you could have an idea about it, but you might not know the steps because, I mean, how many rules did they change this year for the upcoming?
So many.
Right. And there are even more changes coming later on, right?
2025, there's huge changes coming, especially the prescription drugs. Yes.
Can you give us a little bit about what's going to change in 2025?
Sure. So they are bringing, for prescription drugs specifically, they're going to be bringing the max out-of-pocket cost down from $8,000 to $2,000. So you can imagine some of the changes that are going to be happening. The changes are actually going to trickle down to group plans. Might no longer have the qualified prescription drug plans that you have to have when you turn 65. So many of those people might have to go to individual prescription drug coverage. There's going to be more coverage for the plans. That also could mean that cost is going up for premiums. We don't have that information right now. We'll have that in October. But, we believe it could go in that direction.
Yeah, absolutely. And you're giving us the insights because it's an ever-changing business, right? It's why a lot of like insurance people like myself don't really go into that field because of the fact of it's ever-changing. You have to be on it all the time because of the information change, right?
Exactly. And I tell people all the time too, we do so much training. We get training through the federal government. Every carrier that we represent, we have to do training for each product, each carrier. But really where we get our training is through our customers day in and day out, hearing the feedback, hearing the things that, that they're going through with their providers, with the hospitals. It's really the day in and day out feedback that we get is where we learn everything.
I think so, because those conversations you're having with the people across the table or on the phone or wherever it may be, they're giving you, hey, this is what we're experiencing. How does this change? And then you can figure out the plan that works, right? I mean,
exactly.
And then how should someone decide what kind of prescription plan to be on?
So the best way to do that is we actually have programs that we can plug in all the prescription drugs into the system. And these programs take into account all of the carriers that are offered in your state. So let's use Pennsylvania, okay? Somebody's in Pennsylvania and they are on 10 prescription drugs. So they give us the list, we plug it into the system, and then this system automatically shoots out what the best plan is recommended for them. It takes into consideration the premiums, which carriers have all the drugs on the formulary or most of the drugs on the formulary, and then obviously how much everything's going to cost. So on one plan, and this really isn't even an exaggeration. I mean, I've seen this happen several times. On one plan, somebody could have an out-of-pocket of $15,000 in a year because let's say they are on some brand drug that's not covered by that carrier. Okay. So they could have an out-of-pocket on one plan of $15,000. They could have out-of-pocket on another plan of $2,000. That's a big difference. You want to get that right.
Well, that's why I said to you earlier that 530,000 Americans have some kind of medical debt.
Right.
Like they had a medical episode and they can't afford it.
Right.
So if you don't get it right the first time,
exactly.
How do you pay for these things?
Right.
What are other ways besides just out of pocket? Can you use like HSA to pay for Medicare?
So if you have an HSA account already, you can use that to pay for your copays.
Okay.
Dentist appointments, classes, things like that. You can't fund an HSA after you're 65. Really what you get is the supplemental plans that will fill in a lot of those gaps. In certain supplemental plans, you barely have anything out of pocket. So you can, other than prescription drugs, but you can really, get a plan that's going to fill in all those gaps anyway.
Wow. So on the Medicare, and then we'll jump over to health insurance for individuals that are under 65. When we've been doing a lot of podcasts lately of talking about long-term care.
Yes.
Does Medicare pay for long-term care?
They do not.
Because most people don't know that they do not.
Exactly. I run into that too. They do not pay for long-term care. So you need a separate long-term care policy, which is where you guys come in.
Well, thank you for that. But what do they pay for?
So they'll pay for skilled nursing. So if you are on just original Medicare, and that's with no advantage plan, no supplemental plan, they will pay for 20 days. Now, there are stipulations. You have to be in the hospital for at least 3 days. You then come out, you have to go into skilled nursing within 30 days. So and then you have to go into an approved Medicare facility. Okay. So there's definitely rules to follow, and you need approvals. So on original Medicare, you get 20 days covered. Many times they're in there more than 20 days.
Yeah, usually.
Yeah. Because this is where you're doing physical therapy, you're, learning things again. So, speech therapy. So anyway, they'll pay for the 20 days. If you're on a supplemental plan, some of them will go beyond that, and pay for up to 100 days.
Yeah. Because most people think it's like, oh, well, they get 100 days, they get it. And it doesn't work like that.
No.
And we try to explain to people that, it does not qualify you for that.
Correct. Yeah. So it's short-term care is what it is, not long-term.
20 days, people. That's what we're talking about. 20 days. On the health insurance side, so say I decide to retire, I'm 62. Yes. I can come to you for how many people is it?
So we do individuals. So if you're one person or a family.
Okay.
So the situations that we come across are, my spouse is going to stay on their group plan. I want to come off and just go on my own, or my whole family's coming off. Let's, get on to our own individual family plan. So we can do all of those. We can go direct through the carrier, or I check to see if everybody qualifies for Penny, which is where you can get a subsidy through the government if your income is within a certain range. So they look at your zip code, really your county, and your income and ages. Okay. And we see if we can get you some sort of subsidy. If we can, that will pay for part of your premiums for you. And that
could be a huge help.
It's a huge help.
Would that even be included to like businesses? So if I own a business, I'm an individual business, could you use Penny through there? Or
if you're getting an individual plan, so if you own a business and this plan is just for you or just for your family, no employees, you're not offering it to your employees, yes, you can go through Penny.
That's a huge savings. And for business owners that don't know that, you can reach out to Lisa and we'll get her information a little bit, but those kinds of things you can sit down and talk to people about.
Exactly.
Yeah,
exactly.
So what about businesses? Do you do businesses of 5 or more, or 3 or less?
Businesses, we can do 2 unrelated employees or more. So we usually work up to about 20 employees. Okay. So, that would kind of be our niche. Yeah. But, and with that, I would still say, hey, let me run your numbers for individual/family plans. Right. Let me run your numbers for group plans. Let's see what works out best for you.
And usually, does it work? Does it matter? Does it always come out a different way, or is it always?
It's different because it depends what people want.
Right. It really just depends on what the company wants to offer.
Exactly. And by the way, it also matters how many employees from the company want the group plan. Right. We've run into that before too. So where some of the employees will say, "Oh, I haven't had health insurance, so I don't need it," and that creates a problem because you need a certain number of employees. So
yeah, so that's the best part. So while researching it, do your research. That's great. But contact an individual like yourself that helps you make these decisions because you can break it down, right?
Exactly. So we always say you are paying for a broker, whether you use one or not. We do not charge anything. The carrier is not going to charge you more because you're using us. You get the exact same rate, whether you go through a broker or you go direct through the carrier. So why not get the expertise and the experience from the broker? As soon as we hear the sort of, your interest in what you need for a plan, I can kind of narrow down those plans for you from 30 plans to 2.
Yeah, and then you can make an intelligent decision versus the 2 plans versus the 30.
Exactly.
When you're picking A, B, C, D, E, F, and whatever else it may be.
Exactly.
When you meet with your potential clients, are you in home? Are you virtual? Do you do all appointments? How do you do your appointments?
However somebody's comfortable. Mm-hmm. Nowadays, most people want to do things over the phone or Zoom.
Right.
But if somebody says to me, hey, I want to meet you in person, I feel more comfortable that way, I'll meet them in person. No problem.
That's awesome.
Yeah.
So key takeaways from today. Now if you're 65, you need to sign up for Medicare. You're not automatically enrolled.
Correct. Unless you're on Social Security already.
Okay. The other part would be how to decide about prescription plans, which we talked about.
Yes.
And, health insurance, because the penny could save you depending on how it is, if you get subsidized through the government, right?
Correct.
That's a key takeaway. Anything else you want to give us about Medicare or individual health insurance, like a key takeaway for you?
A key takeaway. Let's see. We're coming around to the time where you can make changes. So now's a good time to do, a look at your plan, an overview, and just make sure you're on the right track.
Because open enrollment starts when?
October 1st is when we get the new rates out.
Mm-hmm.
October 15th is when we can start making changes.
And then they have till when? Because they should reach out early. I understand that part, but they have till when to make those changes?
December 7th.
And what's the best way for them to contact you if they hear this podcast and they're like, you know what, we really need to talk to a broker. How do we talk to Lisa?
Phone is the best way.
Okay.
And
what's your phone number?
610-716-1378.
Lisa, thank you so much for joining the Compass Wealth conversation. Listen, ladies and gentlemen, if you have questions about Medicare, you have questions about individual health insurance, for you and your spouse, you can reach out to me, obviously at Compass Financial, and we can get you in touch with Lisa. Obviously, the 610-449-9900. You can hit us up on the website at mycfsi.com. So thank you for joining us. Lisa, thank you again.
Thank you.
And have a great day.
Thank you for listening to the Compass Wealth Conversations podcast. Click the follow button to be notified when new episodes become available. Visit our website at www.mycfsi.com. That's www.mycfsi.com. Or give us a call at 610-449-9900. And don't forget to click the follow button to be notified when new episodes become available. The information covered and posted represents the views and opinions of the guests and does not necessarily represent the views or opinions of Compass Financial Solutions Incorporated. The content has been made available for informational and educational purposes only. The content is not intended to be a substitute for professional investing advice. Always seek the advice of your financial advisor or other qualified financial service provider with any questions you may have regarding your investment planning. Please note that the information provided in this podcast is for general informational purposes only. All opinions expressed by the hosts and guests are solely their own opinions and do not reflect the opinions of any institutions or entities they may be affiliated with. This podcast should not be considered as financial or tax advice. We strongly recommend consulting with a professional financial advisor or tax professional to get advice tailored to your specific situation before making any financial decisions.